Go for it. Hello, everyone, and welcome to today's episode. I'm so excited to have you here, where we're going to have a special conversation about the journey of childbirth. And today we have two incredible experts here, and we're going to talk about the unique role and vital role that they have in supporting childbirth. So we have Dr. Agha and Caridad. And Dr. Agha is a renowned obstetrician and gynecologist who advocates for gentle and water births. And he's got a very impressive track record for VBACs right here in Dubai. And then we have Caridad. So Caridad is recognized as a space holder, a professional space holder, and offering emotional and physical support that makes the world of difference during the birthing process. So in this episode, we're going to talk about the different roles and then how they work hand in hand together, the doulas and the doctors. And we're going to explore the different roles, but we're also going to look at the magic that happens when there's a collaboration. So, and maybe share some real life stories, right? And so let's dive in. And Dr. Agha, what is the role of a doctor during the birthing process?
All right, so hello everybody, and thank you so much for being here today with the amazing team we have. So for doctors, what we're concerned with is safety. Safety of the people we are taking care of, the safety of people we are working with, so our staff as well. So when it comes to taking care of pregnant women, we see them all over the antenatal care, so for a number of months. Through these months, we know more and more about their background, about their pregnancy and how this pregnancy is going on. So we collect data and all information about this pregnancy and the risk factors of this pregnancy or different circumstances. All this will bring us to the moment of labor, where we know what we are dealing with, what we are anticipating, and how we put the best plan to conduct this labor, and how to keep everything under control, if we can say that, and to make it happen in the safest possible way. So that we put the plan for the delivery, we monitor both the mother and the baby's condition, the heartbeats, and we monitor the progress of labor, and we either do interventions to avoid or prevent any complication or bad outcomes, or if any of these things happen, we can deal with immediately at the earliest moment with the least possible consequences on the woman or her baby, so that we end up with a safe and joyful outcome for all the family, and that's what brings all the satisfaction to us as well. So our main concern is the safety that we focus on, make sure everything is done in the best way for everybody.
Excellent. So it's almost a way of being there when something goes wrong, but also the planning that's involved.
Yes.
Right?
Yes.
Caridad.
Yes.
Doula Caridad.
Yes.
Can you tell me your role as a doula during the birthing process?
Sure. I always say childbirth is an event. It's probably the biggest event this couple has seen up to this point.
Yeah.
And we're a little bit like the event planners. Okay, so we meet with you before, so we can discuss things that'll make you feel comfortable. For example, what are you wearing? What are you listening to? But most importantly, we empower you with the information that you need to get to a point where you feel comfortable with your experience. Okay, so we provide comfort measures. We're also very much about holistic approaches.
Yeah.
And we take into play what it is that you want. So your culture, your background, and if there's any conversations that you need to have about fears, we can also have those beforehand. And we advocate. We advocate for those preferences. Okay, so we want to make sure that those preferences are listened to in a respectful way. They're listened to, and that's basically what we bring to the table, right? So we provide emotional support, physical support, and spiritual support sometimes when needed.
I like what you describe yourself as a professional space holder. Can you tell me a little bit more about that?
Yeah, so one of the things, we currently have a doula training program also. And one of the things that I advocate for is the doula herself learning to come from a place of zero.
Yeah.
A place of zero meaning we don't bring our own judgment, our own stories to the table. We're just there 100% for the person.
Yeah.
So providing that space means that it's all about the person and their journey.
Yeah.
So we're mindful and present about them. Never my opinion, never my stories,
Yes.
never my judgment, but it's always about them. So what is it that they need for that moment? So I always separate myself from that. And to get to that place is very difficult. So that's part of our training program where we help the doulas get to a place of zeroness. And this is super important.
So I have a recently shared review that I really want to read, Dr. Agha.
Okay.
It's really beautiful. It's a little bit long, so we might have to cut some out, but we will definitely, post it so that for everyone to read it. So my birth angel, Carrie. My name is Farah, and my husband and I had the most wonderful, gentle water birth, an experience I could never have achieved without your unwavering support of my doula, Caridad, and my doctor, Dr. Agha. We first met Carrie at the water birth talk hosted at Fiki. Within the first 5 minutes, I knew she was the one that I wanted by my side. So soon after, she introduced us to Dr. Agha, fondly known as Aquaman, for good reason. From the moment everything began to fall into place, Carrie attended every appointment, listened with patience, and eased every anxiety I carried. For as long as I can remember, giving birth was one of my greatest fears. Carrie transformed that fears into empowerment. Her passion, energy, and positivity are unmatched. The way she prepared the birth room, the music, the atmosphere, the seamless transitions through each stage felt more like intuition than skill, though she was both in abundance. She was truly my angel, guided me with strength, love, and grace. What touched me most was how beautiful she held space, not only for me, but for my husband. She spoke in his language during the waves of labor, creating space for us to remain deeply connected while offering her solid, grounding presence. And then there was Dr. Agha, calm, patient, confident, and deeply reassuring. The energy or synergy between him and Carrie is something extraordinary. Together they created a birth team I could only dream of, one that made me feel safe, supported, and empowered as we welcomed our daughter into the world. They say angels are present at every birth. For me, Carrie was that angel. Embodied real and by my side every step of the way. I am forever grateful for her, Dr. Agha, and to the beautiful way they guided us into the journey into parenthood. So that is for me, as a mom, it's emotional. It's really, it feels like the way that you two work together, and it's a very unique and magical correlation that you have. How would you explain that? Can you give me an example of where this happens in real life?
Or collaboration.
You mean other than us?
I
don't think it's happening. So many things.
Example during where you could feel this happening.
So, let's say in general, I would say the role of the doctors and the role of doulas or midwives or family members, these are different roles.
Yeah.
But they're all complementing each other. And they're all looking at that same person, the woman, at different angles. So we may all have concerns, or we may all have ideas or things in our mind, but the things I hold towards that person is different from hers or different from other person and things, because each one is looking at different angle. So it's quite critical that we don't ignore or dismiss each other, and we complement each other. We consider the view of all these team members, especially doula, because each one, either we are looking into that person and that person has a different relationship or connection to us. So the connection between the woman and me is different from hers and Caridad, and different from the nurses. So the way she's looking at us is different, and how we look at it different. So we need to complement each other so that we get up to that ultimate happiness and pleasure from all aspects that she feels from all the angles and aspects she looked at. She was considered, she was respected, all her wishes were met, and whatever she asked for, it was done, because we covered all the aspects.
Doctor, I mean, you've done, how many births have you done?
Some number, yeah.
A lot of births.
Yes.
I mean, can you feel the difference when there's a doula involved and when there's not a doula involved?
Yeah, so more and more when I started this current job, and we have been seeing more doula, especially with Caridad, and the more you work closer, so the point of synergy that comes from working together more and more.
Yeah.
So we understand each other, we know each other, we can, we don't need to talk a lot.
Yeah.
All right, so we know what we need, what that moment needs, and what we should do, and we just by looking at each other. And that was one of the feedbacks, one of the patients, that it was kind of not stressful, but it was a kind of serious situation. Delivery, we needed to deliver that baby, and it was me, Caridad, and the midwives. That was amazing. You didn't talk to each other. You just looking and just giving small gestures, and everything was done in the most perfect way, and the quietest way. And we managed to do it. So that's the point. So the more you work with the same people that you are tuned with, the easier will be to achieve such outcomes, because we know each other and we know how to do it. So yes, I think we may come to it later, and Caridad can elaborate more. The role of the doula with the woman and how they connect to each other, it's a huge effect. And yes, it makes a huge difference on the woman in this journey, because it brings a lot of easiness, a lot of comfort and reassurance and support, and that improves lots of outcomes in labor. So in terms of need for pain relief, progress of labor, the chances of ending up with cesarean section, chances of having perineal tears, all these things are much improved when we have a doula next to that woman.
Yeah.
It's true.
And not any doula.
Yes.
Yes, of course. Your favorite.
If we refer to a doula,
Who is your favorite doula?
I don't know.
You can't say. He's not allowed to say.
I don't know if she starts with the letter Caridad and Doula.
No, but what you were saying about the calibration is important, but most important that you value. So we value each other, and we value each other's opinion very highly. And I think that's what makes the synergy. And not just that valuing that we always try to push each other to be greater and to push the limit a little bit more. So yes, I attend all the visits, but that didn't happen until I started attending Dr. Agha's clinic. Okay. Or me arriving at the hospital before them, but that didn't happen until I started working with him. So we push each other a little bit more to be a little bit better.
Okay.
Okay, and then we question the way we were doing things before, and how can we make it better every step of the way. And we always debrief afterwards so that we can even improve even more. And I think that's what's special, because we know there's a lot of misconceptions around what we bring to the table.
Yes.
And people don't value that. They think that birth is something that needs to be managed, right? And that only they can manage the birth in specific ways. And we know that what we bring to the table is reminding the mom that she is bringing life into this world, and she needs to be confident.
Yeah.
And she needs to know what she wants. It doesn't matter what it is that she wants. It could be medicated, it could be non-medicated, it can be water birth, it can be a C-section. But she needs to know what she wants and be confident about it. So my job is to help her get that confidence and to explain to him. And then his job is to support that and be there every step of the way and make sure that it's all going well. And one of the things that I always say about Dr. Agha is that he's very good at bringing peace to every situation. And this is so important, because when doctors come into spaces, they make it about them and their knowledge. But instead, he comes, brings peace, and still makes it about her and her journey, and make sure that she understands what's happening. And this is so important and so key.
And the misconception that there is that there's a little bit of a rift between doctors and doulas.
A little bit.
Tell me a little bit about that. Okay, Dr. Agha.
No, not really, because the moment you get to that understanding or perception that each one has his or her own role, then there's no competition. As you said, we are complementing each other. So it's said, we see what possibly sometimes she can give me hints, I can give her hints as well. So she can bring the attention to some points that might get missed here and there. So that's complementing each other. So it's not like we are doing the same thing at the same time. It's not like that. So I don't think there is competition in that really. Possibly, as you said, that's a misconception. So the issue is, and I think many other colleagues, they feel it's a one-man show wherever they go. So in that room, in the delivery suite, or in theater, or in clinic, it's one-man show. It's only me, and there is no one else. And everybody needs to look at me impressed and just listening to my wise words and not to open his or her mouth at all. It's not like that, and it's not anymore like that. It's a discussion, it's a collaboration, it's an interaction, it's understanding, it's respect, it's appreciation. It's a final kind of satisfactory outcome, not only in the health terms, well-being terms, but it's on all levels. So the joy, the feeling or sense of achievement, and the appreciation and the dignity and all these things. So these things don't come from only medical knowledge and from one person who's the doctor, but from all people around that person.
No. And I like that, me and Caridad had a little bit of a conversation. Caridad, what you said, that it is about the mother's journey of giving birth, right? It's also...
Right. So we say doctors don't deliver babies anymore. Moms give birth to children, to humans, right? So let's focus that energy on that. And doctors are there to support that process, right? They're not managing moms. They're supporting. And supporting, what do we call? Humanizing birth? Support a humanized birth. We're going to pause a second. You sure that he's not needed at the clinic? No?
No, that's
See? So
synergies.
we just need to make sure that nobody is needing him to run out. Okay. And start.
Just do a lap between.
So we were saying that, what were we saying?
about humanizing.
Oh, yes, we're talking about humanizing birth, which is so important. This is all about how the mom feels in her process, in her journey. This is when I teach those gentle birth workshops. We always say gentle birth is not the birth itself, but it focuses on how does she feel. And for me, it's so important how she feels specifically the moment that baby is birthed, that baby comes through, that baby comes through her hands. Does she feel supported? Does she feel empowered? Does she feel joy and celebration? Or is she in shock? Is she feeling disappointment? Is she feeling complete terror? Because that's the first connection she has with her baby, and that's going to impact so much the relationship. And you know it. Yes. I don't even have to tell you because you shared with you that's how you feel.
Yeah.
And that's why you tear up so much when you hear these stories and you come to these workshops, because you feel like you were robbed of an experience. You felt like you were managed.
Yeah.
And women, we don't want to be managed anymore. We want to be active participants in everything that we do.
And I also think it's like we didn't know, for instance, myself, I didn't know that I could do it by myself, right? I didn't trust myself. I didn't have the empowerment. So I think what you do by empowering is giving back that to the woman, that experience, right?
Yeah, we experienced it at a birth recently, too. We're talking about scenarios.
Yes.
I don't want to say names, but her whole family was there. And the mom called it cathartic for herself to see and witness every stage of the way, the support that she had from her doctor, the support that she had from me, the learning that she had beforehand. And the mom said, I wish I had this kind of information. I wish I had trusted my body, or I trusted myself, or someone had educated me in this way.
Yeah.
Because she did have 4 C-sections, but the option of something different was never there. And this was healing for her and her family, for her husband, the siblings, everybody was there. Everybody got to witness, everybody got to experience. And I still get feedback weeks later from their extended family and their friends. And like, oh my gosh, we heard about this amazing experience. We heard about you. We heard about Dr. Agha. We heard about what you guys are doing. And we need to tell the world. How do we tell the world what Dr. Agha and Carrie are doing? Here we are. We're telling the world.
We are. We're getting there.
So I think not just us, but I wish that more doctors and more doulas and more midwives would learn to collaborate. And the misconceptions happen because doulas come into every space with their armor up and a shield. And they come to fight. They feel like they're fighting a system. They feel like they're fighting everybody. And I say, I will never come to birth and treat it as a battleground. How can we make it so we walk into that space and it already feels like peace? This is why the collaboration is important. This is why those meetings beforehand is important. Those conversations, the conversations with the midwife, with the team, with the staff, with the administration, these need to happen before the mom, before she walks into that birth space. And right now, the doulas, put down the shield, put down the swords, and get your butts into these medical spaces and have these conversations and find spaces to collaborate, because this is so key, and it will be key in the way that we move forward in the birthing world, especially here in Dubai.
Yeah. And there's a lot of women that need support, and there's a lot of women that need to be empowered, because we can't do it by ourselves. We need a team. We need doctors, and we need doulas.
Yep, sounds good.
I think if I continue that, so you said if there is any kind of conflict between the doulas and doctors,
Yes.
because so the doulas, the doctors, they in their mind, it, as you said, it needs to be managed. That situation or that person needs to be managed because we look at it in a medical way. But on the other side, we know, and the doula knows or keeps in her mind that she is anti-medicalized things. So they are pro-natural. So first they will have misconception towards that doctor and that team. Everything we will say it's to find a reason to do a medical intervention, which is wrong. From beginning, they feel everything we say is wrong and this is unnecessary, and the woman can do it without this intervention. And some of them, they push the woman to reject any request from the doctors. And the doctors, they will feel, or the team in general, either when we say doctors, I mean the doctors, nurses, and midwife, the medical team, they know that some of the doulas, they are so pro-naturals and they are against these interventions. So kind of a clash will happen between, and in between the woman will be there.
Yeah.
And that won't be helpful, because the woman trusts the doula from one side, and she will listen to her. But from the other side, she knows that she is here under the care of this team who's truly trying to take care of her in the best way they know, and they are professional people, they're experienced, and they're suggesting the right things for her. She knows that. But at the same time, somebody else is telling her different things. Which one to go with, which one to believe.
Yeah.
That's very conflicting and very can be chaotic even, and can be unsafe for the woman and the staff and everybody. So if there is no such understanding and valuing or appreciation on both sides, it will be very difficult, especially for the woman. The woman will be the victim of all this pull of power thing. So.
No, 100%. And I think it's exactly what you said. In the end, that woman is going to be pulled in two directions. And that could be unsafe, right?
Yeah.
And also that mistrust, you need to be in alignment, right? So what advice would you give to doctors and doulas to work together better? What would your advice be?
I think first of all is knowledge. So the more we know, the more we read, about what the doulas do and what's their role. The same for doulas, what the doctors do. And if they know more about the situation itself, and that's what I ask the women to do as well. So tell them, go and educate yourself about what the interventions are normally are done and why we do them, what is breaking the waters, what is the drip of the hormone, what is the pain relief options. So just know about them.
Yes.
So that when we come and tell you you need this and that, you will say, okay, yes, I know that. I read about it. It sounds reasonable. I will go for it. So the same for doulas, they need to know that. They know when the doctors say we need to break the waters, there is a reason for it. And if we don't do it, either there's alternative or not, or there is another outcome or not. So they need to understand that. Then we all need to work together and close to each other so that we see what is the role of each other and how that woman is reacting to each other. So like attending the appointments or attending the labors and all these things. And more importantly is having that baseline of appreciation and understanding and respect. Is the starting point should be that respect and appreciation. I know that person is working for the best of that woman, so I appreciate him or her. I may have different views about that, that's fine, but I know that he's truly inside, he's working for the benefit of that woman. And in case there is any conflict or a disagreement, let's say, in views, we can simply go somewhere else, not inside the room in front of the woman, somewhere else. Let's have a talk. You think this is the right thing, I think it's not. Why is that? What is the best thing? What is the compromise for that? How we can go into terms with that so that we go back together to the woman telling this is the best for you.
Yeah.
And we are both happy with this plan. If we get to that point, I think it will be the best for the woman first and the staff and everybody else as well.
Yeah.
I think also the big shift that's happened recently, especially, is that medical teams and clinics have realized, oh snap, doulas have some power.
Yeah.
Because we do have something that's huge, which is the trust of the community. It's the trust of the couples. And we're the biggest witness at most of these births because we're there the entire step of the way. We see how a hospital manages births. We see how they follow their protocols. We see how they jump to conclusions sometimes, or we see which doctors truly do support a water birth or truly do support a natural birth. We always say there's VBAC supportive doctors, there's VBAC tolerant. Tolerance and supporting are two different things. So we're the biggest witness. So when the community comes to us and asks us, they're like, I'm with this doctor and I want this kind of birth. Well, that's not going to happen for you because we've never seen it happen in that space. So when we say things like that, it does bring a little bit of I don't know, like it makes people upset. I've been told recently, you're no longer allowed in this space because you steal too many patients to bring them to Dr. Agha or to another hospital. And I'm like, patients aren't things to be stolen.
Yeah.
Right? They're people, they have opinions, they ask you questions. If you're not meeting their needs, they have every right to switch. They have every right to find somebody that's going to support them. So that's what a big part of our power is. And I think some of the animosity happens because of that.
Yeah.
Saying that, not all doulas are created equal. Like he was saying, some are so hung up on it has to be 100% natural, hands off. And we've seen that where somebody brought their own private midwife and was teaching her to fight your opinion every step of the way. And I trust his judgment from the first second. If he comes into a space and says, we need to do this with that doctor face that he gives you, because he never uses a doctor face unless it's really necessary, then I know, because I've witnessed his hands-off approach where he trusts the process and he supports the woman. So we are the biggest witness. But in that situation when he came in and said, this is necessary, we need to do this now, and that midwife was like, nope, no, keep saying no, cover your face, hide yourself in the bathroom, cover yourself, remember, you don't know who I'm talking about. Cover yourself, hide, keep saying no. Fight him till the end. And it came to the point where at the end she's finally said, yes, I need to listen to you. And then the baby ends up in an ICU for a while. And she doesn't forgive herself because if I had listened at the beginning, then the situation would have been different.
Yeah.
So yes, we're the biggest witness and we do see, but I can 100% vouch for him because I've seen him go to the extreme and allow women to birth in the way that they want to, and beautiful, magical, spiritual births. And that are like goosebumps. But I've also seen him step in emergency situations and handle it with calm and peace, and everybody's happy and everybody's safe, and there's no trauma around it because everybody understood the process.
Yeah.
So I think that's so that's the synergy.
Yeah.
That's the synergy.
Would it be correct to say that both of you has got a specific place And so you know where you stand when you're in the birthing process. You know your role, basically.
So when he comes in and it's emergency, I'm the one that holds your hand. Trust him, let him do what he needs to do. You just focus on me. Let's breathe together. Remind yourself that you're safe, that everything's okay. You chose this team for a reason. So I'm just reminding her to stay present, to stay calm, to tap into that trust, and just reminding her to continue to breathe, connected with her body, connected with her baby, and still find the joy in that moment as he needs to do what it is that he needs to do. So like I help her be calm in that moment so that he can do what he needs to do. I'm not there to say, no, don't let him do that. No, that's not what I bring. I bring the peace and I'm the bridge. I'm the bridge.
So in the end, by being the bridge, you also empower the doctor, right?
Yes.
So by supporting the doctor.
So if anything, all doctors should have a doula. We always joke around, every doctor should have a doula. And like this should be a thing in every clinic, because we do. We are that bridge between the spiritual, the natural, the holistic, and the medical. And I think they both need to be there. Like I think medical is super important. I birthed 6 children myself, and I was always in a hospital. I didn't need interventions most of the time, but I knew I was there in case if it was necessary. I was in a safe space. Okay, and I know the importance of it, to the fact that I went to a hospital even though I was in the US the first 4 babies and I could have birthed at home, but my choice was to be in a hospital setting. So I do trust the medical system. I trust what they bring to the table, but I also know how important the spirituality, the healing, and the rite of passage that childbirth is for a woman. It's so important,
So I recently had a conversation with, she's a photographer and she takes pictures during birth, and she's from South Africa, and she told me that after COVID, 50% of births now happens at home with a midwife or a doula.
Here in UAE?
No, in South Africa. So I do think there's a need for it, and things are changing. Do you see the change?
In that specific example, possibly it's difficult here because we know, I think, from the legal point of view, it's not allowed to have births. So it's not like a common thing. But I know there are a good number of women around the world, they will prefer to stay at home because simply it's home and safe area, and they know the place and they feel confident, they feel relaxed and all these things. So I think if you give the option for all women, at least 90%, I think they will opt for their home, providing you are reassuring for them or assuring them the safety net. So in case you need access to hospital, you will go immediately to them. So I know that certain countries, certain areas, home births are not a safe option because they are remote from the hospital. You need to have easy access, easy traffic to hospital in case you need, because that's the critical thing is when to go to hospital and how long you're going to take. That's what makes it successful and working. If you can't guarantee any of these things, then home birth can be difficult. But so in general, I think if the woman giving the option and giving the reassurance, I think I wouldn't say all of them, but 99% they will say yes. Second thing is COVID, I think, changed the world at different levels, at many ways. So one of them is the way people will look at the delivery and where to have their babies. That's fine, of course. It's true.
But saying that, the reason women choose to home birth is because they lost the trust in the medical professionals. And they lost that trust in their whole body autonomy, right? Things are being done to me that I don't want them to be done to me when I don't want them to be done. But if you can find a space that will allow, everybody knows I hate that word, but will give you that space to do what it is that you need to do, and they can trust you, they're more than happy to go to a center and experience the birth. We do teach a little bit, about the importance of oxytocin and endorphins in the process of childbirth and reducing the pain and getting you to a state of euphoria. We always want to get to that euphoria state. And we say interventions will interrupt that flow. So getting into a car to head to a hospital is a huge intervention. It totally is. You walk into the hospital, they turn on the light, hand me your Emirates ID. They start asking you, when's your last menstrual period? And the woman is in the middle of a contraction. Interruptions. And then we know this is interrupting that flow. So if we work out that system to make it where the mom can come in, arrive, and be relaxed and calm, let the husband do the talking. She keeps the sunglasses on. The music is played. The doula has prepared the room for her. These things help and allows for that euphoria state. We call it euphoria. We see it in the women where they're giving birth and they've just gone, their consciousness has gone somewhere else.
Really?
And that's the goal.
Yeah.
That's the goal for everybody. But we see it all the time where they're just not here. They've gone, we always say in the spiritual world, they say the woman has left her body, she's get the soul of her baby and then comes back. So like that physically kind of, like you see it where they're just not there. But it's totally doable in a space where you trust your team and they give you that space where it's a little bit more hands off. They leave the lights off, they let you do what you need to do, and then you get into that movement, that grace, which is gorgeous.
So your role as a doula, it doesn't only start at the birthing process, it starts way before.
Right. I'm hoping it starts before they even get pregnant. Because I was saying childbirth is a rite of passage, but not just into motherhood, okay, but into healing so much of the conditioning. And I'm gonna plug it. I'm writing a book, The Birth of a Mother, and each chapter specifically focuses on a learning that I had. So each child brought a learning or a healing for me. And my daughter, for example, she brought for me remembering. So remembering generations of women and what it is that we brought. So we always know the men were the fighters, the hunters, the strong keepers or protective, and feminine energy was we were planting the seeds. We were bringing peace. We were making home. We were making it so, like we always say, if you teach a woman to read, you teach the village. If you teach a boy to read, you teach a man, right? 100%. So like it's different. So it was that remembering of what I can bring and how I can contribute to community and the village and just spread that seed. And I think that's exactly when I started my doula journey. So I think pregnancy, becoming a mom is so huge for us to learn our purpose, because I feel like if we find our purpose, this is so important. So as doulas, we have these conversations so that we can kind of uncondition that programming that you have around what your life needs to look like, so that you can make it what it feels the simplest for you. The simplest is always the way to go, because that's the way that was meant to be. Yeah. That's our role. Right? Easy?
Yeah, very easy. No, back to the example, as you said, that was one of the first, let's say, understandings we got about working together is being a bridge between the doctor and the woman. Bridge that works on both directions. So sometimes the doctors, the way the doctors and the things they say to the woman may not be perceived totally by the woman for different reasons. Either the language we are using, either the barrier we have, like the doctor, this is authority, or doctor or uniform or whatever. There is a kind of a barrier between us and the woman. They may not catch everything we tell them, and we may not be able to explain it in the way the woman would understand and appreciate. So Caridad will come and will make it easier for them to understand, and will explain it more and make it conceivable. From the other side is that once Caridad feels that what I need to do is necessary, she will explain this to the woman. She will reassure her, trust him, this is the right thing, don't worry, bring your hand, everything's fine. And she will make it easier for the woman to take the decision and accept the plan. So it works on both sides, for both the doctor or me and for the woman. So that's kind of interaction we have, and that's kind of the team roles that for each one.
And with this synergy, the person who wins is the mom.
Yes.
The mom and dad who
the baby.
And the baby.
Yeah. Baby wins. Best birth ever. Yeah. This human being comes into a space where they know trust and understanding from day one. Yeah. And this is so important.
What you said just now about mom and dad arrive to the hospital, they ask for ID, it's busy, she's maybe having contractions. Just the knowledge of things that you can do. I wouldn't even thought about that. So it's also just to have somebody guiding you through options.
So we get to be the bridge and the buffer in those moments as well.
So are you there when things start happening or when they go to hospital?
The only thing I don't do is move in with them after. I mean, I've been asked a few times, can you just come home with us? But I'm with them before, when they arrive at the hospital, through the entire labor until the baby's born, and even a little bit after that. So I'll sit in a corner, and I'm watching that she feels comfortable. She has that skin to skin with her baby. She's getting to a place where she's bonding. She's experiencing that golden hour, like we call it. And once they look comfortable, I kind of just, like Mary Poppins, just grab my little bag and just walk out, right? And then I see them again in the postpartum visits with Dr. Agha. And our clients, they tend to have more postpartum visits, I feel, than anybody else. They just keep coming back because they do enjoy that experience. And then we have our family wall, we call it. There's these pictures of all these journeys on the wall. And they love to come back and see their picture on the wall and take the picture. And it does feel like this one huge community.
Family.
And they feel bad if we tell them, okay, we are done. This is the last visit.
They're like, what else can we do? She's like, yeah, bring it again.
So I'm not coming back again to it. Okay.
I'm like, but that's why we do stuff like the matcha mornings, coffee mornings, so that they can continue to come back and ask questions and still feel like they call me auntie. I'm an extension of the family, and I love it. I have so many nephews and nieces now.
So many babies.
So many babies.
Dr. Agha, and your role, where do you come in? Right at the end of the birth? Or?
Oh my gosh, so I'll give you an example. We love right science. I use that in one of the sessions or something. So we tell them that the birth or delivery is like when you're driving your best car, right? So whatever your dream car, Porsche, BMW, or whatever it is, and you're enjoying every single thing or item inside this car, the steering, the audio, the everything, interior, all these things. These kind of a pleasure or these details are given to you by the nurses and the doulas. They are making you enjoy every single moment you are in that inside that car. For the doctors are the airbags hidden in that car.
Okay.
They're there. You may not see that doctor at all. You may just come and pop in a couple of times just to say hello, to make sure everything's okay. But we know what's happening. We get an update from the nurses or the junior doctors or the doula. This is what's happening. We are here and this is the plan. We may not need to come in and do, if we don't need to interfere. If everything is going well and everything is reassuring, we don't need to come in. But we are there. In case there is any problem happening, any complication or whatever, we will just pop in and the woman will see us in front of us. So we are there, but not visible. But we know what's happening and we have a plan for everything and we prepare ourselves for the worst case scenario. That's our problem. We are kind of pessimistic people. We look at the worst case scenario. That's the problem. We don't look at the 95% of good things that can happen. We look at the 5% how bad things can happen. So we are there preparing ourselves, and in case anything happens, we will come in and we will do whatever's needed from us.
But it's key to know that every doctor's risk analysis is a little different than the next. Yeah. And some like to engage the airbags a little bit quicker than others. So did you hit a tree? Airbag needed. Yeah. Is the tree 30 meters ahead? Maybe we should pop the airbag just in case. And I think that's the difference. And finding that doctor that will, not jump in as quickly as the other one, I think might be a little better. Yeah. And I think it's a tricky thing to navigate. And I think that's why having people that have witnessed these scenarios, it comes in handy.
Another question that I have for you as a doula, when you work at different hospitals, different doctors, can you see the difference or can you fit in almost everywhere?
I don't want to answer that. No, there's amazing doctors everywhere. They're trained really well to be medical. They're trained really well to do what it is that they do. Yeah. Okay. I respect doctors. The hours are insane. Yeah. The commitment is insane. It's a lot of work. Okay. Especially the ones that are too busy for their own good. Because they're so busy, they make decisions based on that exhaustion to try to make it a little bit quicker for them, in and out, or they make decisions based around their holiday schedules, and it's this is what we see more and more, and it's a sad state of affairs. because then it takes away from that sacredness, the sacredness that's so important to keep at every birth, because every birth is sacred. And when they've done thousands of births, I think they lose a little bit of that remembering that this is a sacred journey for this couple. This is the first time they've ever experienced this. They haven't even seen a birth. You've seen it a million times, but by you coming in and treating it like tick, 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 you've taken something away from them. And if they can just remember that, and then by having maybe the doulas and the midwives take a more of a role, they can step back and relax at home, have their tea, and then call in when completely necessary. They need to trust the team as well, so that they can have a bit of a more hands-off approach, I think. So it's I don't know. I don't think anybody's wrong.
Yeah.
Everybody does the best they can. I always say, did that person do 100% of what they know? Yes. That's not a bad doctor. That's not a bad person. That's just who they are. So now you have to decide, do I mesh well with these people? Because I'm not the doula for everybody. Not everybody likes the pink hair and the sassiness and the spirituality. Not everybody wants that.
Yeah.
Somebody wants a more headmistressy approach, or or more by the book, or I'm not for everybody. He's not going to be for everybody. 100%. We get it. But it's about finding the person that's right for you. And I think they're out there. So it's about not just going to one doctor and saying, I'm committed to this doctor. For some reason, people do that. Well, I've been with this doctor for 5 months. There's no way I can switch. I mean, I'm committed to them. But why?
Yeah.
Send them a thank you card. Thank you so much for the work that you have done. I appreciate it, but I found somebody that's more in line with the wishes that I want for my birth. And that's it. I don't think they should get offended by that. I mean, they might, but they shouldn't. But then I think, not every doctor is for every person, and not every doula is for every person, and that's okay. That's okay. I mean, I think we're the best.
That's for the people who like our approach, all right?
But not for everybody. We're not the best for everybody.
Yeah. So how is it, Dr. Agha and Caridad, to work together?
Wow.
Put you on the spot.
She's sitting next to me.
I'll cover
No, of course. I mean, when you start, so let's say two things to consider. First, when you work with people and you're starting with them from scratch, that will make it easier because you're both growing.
Yeah.
And then you both reach to the same stage at the same time. But when you are already achieved certain levels and you meet each other, it can be a little bit challenging in the beginning because each one has already grown his or her own ego and perspective of life and how they do things and their attitude and how they like to do things. So to accommodate or make some change for the other person, it can be challenging a little bit. But if you, let's say, both of you started from scratch and you knew each one, it will be easier to accommodate. Like having an affair and then ending up with a marriage rather than meeting someone kind of an arranged marriage and things.
Yeah.
So that's one. Second thing is defining the roles. So again, I mean, each one, when you feel that this is my area, I don't want anyone to step into it, and nobody should touch that, and I wouldn't accept that.
Yeah.
So that's another challenge. So, and in any way, again, it's yes, time will make things easier, but if you don't have that thing inside you to accept that other person and to be ready to work with that person and to be ready to make the change for that person, you won't get anywhere, even after 100 years or something. So if you don't have this material inside you, that what you call flexibility, resilience, team working, appreciating other people or whatever, you won't be able to work with other people. So I think that's the most important. So definitely in the beginning, until you'll get into situations to know each other, to the limit of each other, the how we trust each other, all these things. And everyone has his own kind of prejudices, or what do you call it, the things that you know about the conceptions you have about the other person.
Yeah.
So conception towards doctors, or my conceptions towards a doula, whatever. Then how then to negotiate all these things, and you end up with kind of trimming all these things and ending up with this energy you have. So it needs work. It's a relationship that needs work. If you are not ready to make this work, make it succeed, then it's difficult to do it. So yes.
And Doctor, correctly so, I think all relationships is work,
Yeah.
right? So it doesn't just happen.
I'm easy. What are you talking about?
All right. Okay.
Especially some.
That's fine.
It's so easy. What are you talking about? For me, we talk about that. The perceptions that we have of doctors, not just perceptions, because we've witnessed it. I've gone home so many times and gotten in a fetal position and cried, and my family had to hold space for me because I witnessed a birth that was just so outrageous and so taken away from this mom's power. And it's stuff that I can barely recover from. It would take days for me to recover from. I had to participate in this because there's nothing I could do to stop it. Because I didn't have that kind of relationship, or because they just don't want you to stop anything in that moment. You're just not allowed to, okay? And so what he's done by increasing the trust in the system, in the doctors, we call it healing the doctor wound. So like in the spiritual world, we heal wounds that we have, a mother wound, a father wound, different wounds that we have. And he's healed that, like, doctor wound, that medical wound, by becoming empathetic and communicating and being able to be someone that we can trust and know that he's there for the human side of it. So he's healed a lot within me. And in turn, I can teach the other doulas that we're training and telling them that there is chances to find these people out there and challenging them to go out there and finding them. And it's so important. And I think together we can heal certain things and make it better for all the moms.
Yeah.
Is that good enough for you? What do you think? Dr. Agha, is that okay?
Of course. Everything you say is true.
That's true. He's the best.
But I think what I'm hearing is that there's a collective healing that can happen when there's a synergy.
Yeah. I think so.
Beautiful. Yeah.
I think so. And I've sat recently at one of my mom's mornings, and most of them were clients of mine or patients of his, or they weren't even clients of mine, but they were patient of his or vice versa, whatever. And every mom sitting in a space was like, oh, I had an amazing birth experience. And then they got talking about the parenting journey and what they've been experiencing. I had a great experience. I had a great experience. I had a great experience. If I sat in that same space 3 years ago, 4 years ago, 5 years ago, everybody is terrified. No, my experience was horrible. One of our clients recently that had a healing VBAC, I met her in one of these circles where she had sat down shattered crying about her birth experience, where she felt like she had been taken into an emergency situation without her understanding what was happening, and then things were done to her and she never recovered from it.
No.
And then less than 3 years later, she has a VBAC experience with us. And she's like, this postpartum has been so different. And the connection with the baby has been so different. And me as a person, I feel so healed and so much better. So I think the more information we get out and the more we do it and the more people are like, oh, wow, it's possible. I think we do have that collective healing and it can happen. And allowing moms to have a good first experience, not let it be a healing second experience. Please do the work before the first one. I always say birth, there's no do-overs. You get one chance to get the team, to get the space, to get the information, the confidence. You get one chance. Don't mess it up. I wanted to say another word, but we're keeping this PG.
Yeah, it's really beautiful. It really, I think it's a process that I'm sad that I didn't have. Really,
You still have time, right?
Definitely not.
Okay.
My
She can be a doula and let experience births for other people.
I don't think I'm doula material.
You have daughters then?
I've got 2 boys and a daughter.
A
And one
daughter.
Yeah, so maybe she can have.
She can have. So you.
And then you can be in the space and have a cathartic experience. There you go.
Exactly. So that's what's going to happen.
Amazing.
Yeah. So thank you so much for joining us today. And I want to, with a big heart, say thank you to Dr. Agha and for Caridad for being here. And my takeaway is definitely that the birthing experience is not only a medical intervention, it's a like Caridad, exactly what you said. It's a rite of passage that a mom goes through. It's emotional, it's physical, but also very spiritual. So until next time, stay curious, stay connected, and remember, it's your birth and your birth matters. Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you.